we have just a few housekeeping items to go over before we get started. All attendees have been muted, but we welcome your questions and comment in the chat at any time. You can open the chat window by clicking on the chat icon. Just be sure to select all panelists and attendees from the drop-down menu to share your comments with everyone. Jacqueline Leskovic and Miles Dietz-Casto, my Region 6 colleagues, are providing technical assistance, and we'll be keeping an eye on the chat. We'll queue your questions as they are posted, and we'll save them for our speakers to address at the end of their presentation. Closed caption has been enabled, and it's available by clicking on the closed caption icon. We're recording today's session, and we'll post it on the NNLM YouTube channel in 1 to 2 weeks. Everyone who registered for this session will receive an email with a link for the recording at that time. This class is eligible for 1 Medical Library Association continuing education credit, and you'll be able to claim this credit through the evaluation link that we'll share with you at the end of the class. And speaking of that evaluation, your feedback really matters to us, so help us improve future trainings by taking a moment to complete that. So some of you might be first-time attendees to one of our webinars, so I'd like to take a few minutes to share some words about who we are. NLM, the National Library of Medicine, is the nation's largest biomedical library, and it's one of the 27 institutes and offices of the National Institutes of Health. It maintains and makes available a vast print collection and produces online resources like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is a grant-funded outreach and engagement program of the NLM, and it's focused on expanding access to quality health information. The NNLM is made up of 7 regional medical libraries, 4 national offices, and 4 national centers and 3 national offices, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. Region 6 includes the great states of Iowa, Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. And if you'd like to find your regional medical library and learn more about us, you can check out our website. That's nnlm.gov. Today's session was organized by Region 6 as part of our Speaker Spotlight series. And this series features expert guest speakers presenting on topics of interest to all of our users, from librarians to public health practitioners, educators, clinicians, and others who work with health information. The topics are scheduled according to interest, timeliness, and speaker availability. So it's my pleasure to introduce the panel for today's Speaker Spotlight. We have 5 members from the NExT project with us today. Dr. Krista Jones is Director, College of Nursing and Clinical Associate Professor, Department of Population Health Nursing Science at the University of Illinois Chicago Urbana campus. Rebecca Rzuski is Associate Professor in Information Services and Liaison Librarian at the Library of the Health Sciences, University of Illinois Chicago campus. Carmen Howard is Instructor and Regional Health Sciences Librarian at the Library of the Health Sciences, University of Illinois Chicago Peoria campus. Patty Eathington is Associate Professor at the School of Nursing, Western Illinois University in Macomb, Illinois. And Dr. Susan Vonderheide is Director, Nursing Research and Interim Coordinator of the Nurse Residency Program for the University of Illinois Hospital and Health Sciences System and Clinical Assistant Professor, Department of Human Development, Nursing Science at the University of Illinois Chicago campus. So we've just had a whirlwind tour of Illinois. Welcome to all of you. And I'm now going to turn off my camera and we'll turn the session over to Krista Jones.
Thank you so much, Erica, and thank you to the National Libraries of Medicine's Region 6 for the opportunity to speak with all of you today about this significant work, Nursing Experts Translating the Evidence, Next Steps, a unique nurse-librarian collaboration. I'm going to share my screen here. Hopefully you can see those slides. As I said, my name is Dr. Krista Jones, and I'm joined today by Carmen Howard, Rebecca Rzuski, Dr. Susan Vonderheide, and Dr. Patricia Eathington. We would like to ask you to either hold your questions or to place them in the chat, and we will address them at the end of the presentation today. We do not have any conflicts to disclose, and this project was funded by a National Library of Medicine grant. Our team included academic faculty and clinical agency nurses, as well as university librarians and hospital librarians. Per Sackett, Strauss, and Richardson, evidence-based practice is the conscientious, explicit, and judicious use of current best evidence in conjunction with clinical experience and patient values to guide clinical decision-making and service delivery. Public health nurses in Illinois serve diverse populations with expansive health risks and conditions. However, many public health nurses do not have access or training in the use of evidence-based practice resources. Many public health nurses work in small local public health departments that are unaffiliated with large academic institutions or hospitals. Seeking to address this overwhelming need, public health nursing faculty at UIC sought to partner with UIC librarians engaged in evidence-based efforts for other disciplines across the university. The University of Illinois Chicago's Library of the Health Sciences and College of Nursing have been engaged in a series of evidence-based practice education programs targeted to nurses since 2004. Rebranding these efforts has nursing experts translating the evidence project in 2014. In phases 1 and 2, we continued our long tradition of enhancing professional practice by educating public health nurses on where to find free and reliable government resources, how to successfully use them for their specific information needs, and how to translate that information into practice. In phase 1, we created 4 regionally dispersed nurse librarian dyads and conducted 11 in-person evidence-based practice sessions in health departments and community agencies across the state to 69 participants. In phase 2, we created a 3-hour online module using SoftChalk software containing narrated PowerPoints discussing critical evidence-based practice content. Nurses earned 3 free continuing education credits for attending the workshops, but attendees came from a variety of professions. For example, we had dietitians, home health aides, and librarians attend these sessions. Further, we created 2 social media accounts using Facebook and Twitter. This map shows that regional locations of phase 1, including the northern area of Illinois, Chicagoland area, western, central, eastern, and southern sections of the state. In phase 1, 97% of participants reported the NExT evidence-based practice sessions were a good use of their time, while 84% reported interest in attending a future session. Findings demonstrated increased development of new skills and increased ability to find evidence-based literature among participants. In NExT phase 2, we witnessed 570 public school health nurses complete our online evidence-based practice modules. Survey data from this, the most recent phase of the NExT project, indicated 68% of participants would like additional online educational content from the NExT team, and a need for continuation of our work with public school health nurses, as well as expansion to acute and ambulatory care settings. I would like to now turn things over to Rebecca Rzuski for a discussion of our phase 3 project.
Thank you, Krista. So this slide shows the project aims for NExT 3. We expanded the modules beyond public health to include acute ambulatory care nurses. We wanted to provide free continuing education. We also wanted to create modules that would work on multiple kinds of devices and promote these modules through online and print materials. Next slide, please. For NExT 3, all community, hospital, and clinical agency partners sent direct emails to nursing staff and advanced practice nurses, encouraging participation in this project. In addition, Informational flyers were shared during meetings and within agency newsletters. Postcards were mailed to all health departments in Illinois. The emails, flyers, and postcards contained a hyperlink to the NExT module website, as well as instructions for completing the evidence-based education. Once the website is accessed, participants can choose to complete the acute ambulatory care modules or the public school health ones. Each is a 7-hour course with evidence-based content for nurses specific to those practice settings. Next slide, please. And this slide is a visual overview of the module's content. The NExT modules assisted the nurses in efficiently accessing valuable resources to inform and improve their practice. Narrated PowerPoints were developed for each module on the following topics, and this includes the EBP process, finding evidence, appraising the evidence and translating the evidence, learning, leadership, and professionalism, and sharing the evidence and results. Next slide, please. For the public school health nurse modules, we developed a case study to address a high incidence of STDs in a rural community. For the acute ambulatory care module, we utilized case studies on heart failure and pediatric oral care. Each case study walks the participant through the problem, population, and setting. The development of a PICO question, how to find the evidence, background, and statistics, conducting a literature search, and critical appraisal. Handouts and tools included a PICO worksheet and critical appraisal analysis are provided to support the participant in completing the case study, as well as addressing current and future practice concerns. The asynchronous online format provides greater access to hospitals, clinics, and health departments that are unable to schedule staff to obtain this content through in-person sessions. The library guide and modules were launched on January 12th of 2021 among the hospital clinical partners, health departments, schools, and community agencies. Next slide, please. We utilized several instruments to evaluate the success of this project. After participants chose which set of modules they wished to complete, the participants followed a series of hyperlinks to complete the pre-education survey. Then they did the education module, and then they did the post-education survey and course evaluation, all in that order. Part of the evaluation also included web statistics tracking, module views, the number of CEUs granted, and pre and post training surveys. A 5-point Likert scale was used to measure the following: frequency of NLM, resources usage, knowledge attainment and understanding regarding the use of evidence to improve practice, development of PICO questions, critical appraisal of the literature, knowledge translation, and dissemination. We received IRB approval and letters of support from all the partnering agencies prior to implementation. Next slide, please. And this slide shows the resources that were highlighted during the NExT modules. And as you will see and recognize, most of these modules are freely available and from our NLM resources. So now we're going to move on to the online demo of the resources. And I'd like to turn this over to Carmen Howard, who is the University of Illinois Chicago Library, the Health Sciences lead on the NExT project. She was the one who built the modules. And while we're moving on to the demo, I will give you an overview of which tools were used to build the modules. The landing page for the modules that included the online resources you just saw were built using LibGuides, the content management information system used by libraries. And then I think Jacqueline had answered this question a few minutes ago, that the modules were built in SoftChalk, which is a web-based platform that can be used to build online lessons. YouTube videos of the narrated PowerPoints were embedded into the modules in SoftChalk. So I'll turn this over to Carmen.
Thank you, Rebecca. Can everyone see my screen share? Yes, okay. So I will just say that we have told you what software we used, but obviously this isn't the only solution. We made the decisions about our software choices primarily based on money, if I'm honest, because we needed to choose things that our institutions supported. And we wanted to keep all of the content free and fully accessible. So that really drove a lot of our choices. As Rebecca said, this part is the portal we like to call it, and it is built in the LibGuides software. When you enter at the main page, and we'll be sharing the link, it's go.uic.edu/next EBP. When you enter here, you actually can see the two different paths that we were talking about. We have both a public health portal and the acute and ambulatory care portal. We also have linked here some information about the project in general and things that we've managed to accomplish. But we're going to just jump right into the public health portal. Okay, and now hopefully you're seeing this page, and you can see that our side menu has changed quite a bit. Now that we're in a public health path, we can see our topics listed here in the side menu. Again, we've provided some basic information on this page, but let's jump to one of the topical pages, and I'm going to choose Finding Evidence. Finding Evidence is a fairly typical topic page. You can see that we start here with some basic educational content to help you find evidence. And then as you scroll down, you can see that there are a number of resources that we have linked to. Every page is meant to be something that someone who took the course could come back to refresh their memory about what they learned, to access resources, but also to be someplace where someone who hasn't taken the course could come and learn a little bit. All of the pages are roughly the same in terms of the way they are built. So we're not going to go through all of them. And in terms of the way they look, the acute and ambulatory care side and the and the public health side are both the same as well. They have a little bit different content, obviously. So if we scroll down through our side menu, you can see that we do have a page here that says it is for the online course, and we will go to that page. When you come to this page, you can see that we have, again, some basic information about the course. We also have added here our frequently asked questions, and these really address a number of things that came up when we first launched these courses. And they're primarily, the questions were about the asynchronous nature of the course, tracking yourself through the course. People wanted more details about the CEUs, and those are all shared here. But we are going to go ahead and jump right into the course. And this is where you can see that we switch into the SoftShock software. This is the overview page. And again, we've given some basic information here. And if we scroll down, you can see that we have a couple links at the bottom of this page. We do ask that everyone who is seeking continuing education credit do a survey at the beginning of the course, and then they'll be asked to do a second one at the end. However, we also provide a link here for participants who are returning, and that is because we are not storing IP addresses. We're not keeping any of that information, and we also are not assigning everyone a unique ID that gets them back into the course. So if you have been in the course, you come back in at the same point that you came in the first time. So we're going to pretend that we've already taken the survey, and we will jump right into the course. So this is our first topic page. If we scroll up here a little bit, just to kind of get our bearings, you can see that we have provided navigation by page at the top. We also have a sidebar that provides navigation by topic. If we scroll down, you can see that we have previous and next buttons. And then also we provide a proceed to next page, easy link, so that if someone is just moving from page to page through the course, they can use that. Back up here at the top, each lesson or each topic has its learning objectives. It We also provide some basic information about how long we expect it to take you to watch the videos, and then some just general guidance about what works best within the course. We have also on each topic handouts here in a sidebar. Here's the case study that we were talking about earlier, and every single one of our lectures has a text document, so you can view the lecture text that way as well. But really the meat of each lesson is the videos that we have provided, our lectures. These were done by a number of different members on our team. And they work within SoftChalk. This is an inline player that you just click on and it will play the video for you right here. The other important part of each lesson are the learning activities. So if you look at our various learning activities, we've used a lot of different ones. Here in this first lesson, you can see we have an ordering question. We have some matching questions. And then if you scroll all the way down here, we also have some learning prompts. And these are really a great example of the way that we have used an adult learner model throughout. A lot of what we have done is designed simply to reinforce the learning that's happening in the lectures and give people an opportunity to use some of those skills that they have just learned. We do not keep any answers. We do not assign any grades. Everything is designed for someone to have the learning reinforced. So you can see that if I go back up here, I'll go to this PICO question. And if I leave the answers in the default and check my answer, you can see I get that it's partially correct, but that I didn't get it all correct. If I go back, I'm allowed to change my answers and I can check them again. And again, I in this case, it's still gotten it partially correct, but it tells me which ones I have correct now. And I could keep repeating this as many times as I'd like until I knew the full answer. And that way, we're really just trying to reinforce. We want people to have the ability to look at it over and over again. And again, we are not assigning grades. We are not keeping track of the answers that people get. It's just an opportunity to learn. So each of the topics is set up the same way with lectures, either one to, some of the topics have quite a few lectures. The lectures can be short or some of them are long. And then there are activities afterwards, opportunities to reflect, opportunities to apply what has been learned to your own practice situation. And then once someone has made their way through the entire course, over time at their own pace, then they are asked to fill out the final survey and complete a CEU evaluation. Once they have done all of those pieces, they are given an opportunity to print their CEU evaluation, and we are then storing the information for our CEU records. And I think that at this point, I will turn everything over to Dr. Susan Vonderheid to talk a little bit about the results of some of those surveys.
No, thank you, Carmen. Okay, thank you so much. All right, so as she mentioned, the next couple of slides are going to tell you a little bit about our participant characteristics and the evaluation results. So looking at the text on the bottom of the slide, you'll see that 312 acute and ambulatory nurses completed the pre-survey. And we had 108, which is about 1/3, who fully completed the course, keeping in mind that people can come in and come out as they choose. So people are in progress. And then there were 84 public health and school health nurses who completed the pre-test survey, with nearly half, or 108, of those who fully completed the course in the post-test survey. And again, the remaining participants are in their varying stages of completion. So most public health and acute ambulatory care participants identified as female, and you also can see on the slide Caucasian. The figure on the left shows the wide age variation with public health and school nurses. They had the highest percentage in the 20s. And then the lower trends, it trended down across the decades. While not shown on this chart, which is consistent with the age distribution, the majority, or 77%, of acute and ambulatory care nurses identified as having 6 years or more experience, compared to only 48% of public health and school nurses who had at least 6 years of experience. Now, the figure on the right shows the majority of RNs had a bachelor's degree or higher. Next slide, please. Participants were asked to describe their mobile device use as a nurse. The pie chart shows that participants indicated high levels of mobile device use. The blue and the red areas of the pie chart show that those who reported mobile device use said it was either essential, regular, or occasional as a nurse. And then when asked to describe their level of interest in EBP, you'll see that the bar chart shows that a total of, when you combine very interested and somewhat interested, 90% of the participants reported being very or somewhat interested in EBP. Next slide, please. Statistically significant increases in participants' understanding and their perceived use of EBP concepts and resources were found for all of the categories. The graph on the left represents the increases in the use of resources. The blue line represents the acute and ambulatory care nurses. They reported the largest increase in the community guide by 63%, Cochrane by 45%, and then CINAHL by 39%. And then this was followed by PubMed at 36%, the US Preventive Task and Joanna Briggs each was 31%. So the top three largest increases for the public and school health nurse cohort was the Joanna Briggs by 69%, Cochrane by 51%, and the US Preventive Task Force increased by 40%. This was followed by a 22% increase in CINAHL and a 17% increase in PubMed and 14% for the community guide. The graph on the right represents a change in the participants' understanding of all EBP concepts. In both groups, from pre to post intervention or completion of the modules, the largest increases were reported for critical appraisal, PICO development, and translating evidence. Next slide, please. When asked to rate knowledge attainment and understanding regarding the use of evidence to improve practice, development of PICO questions, critical appraisal literature, knowledge translation, and dissemination were among the top four. The largest increases were participants' affirmation that they developed new skills as a result of the education. They reported better being able to find systematic reviews, meta-analyses, and practice guidelines in PubMed resources. They were better able to determine if the evidence in the literature was appropriate for their practice site and to develop a plan for implementation of information from the literature at their practice site. They were also personally motivated to use these concepts in practice and found the education provided opportunities to practice the newly developed skills. The level of confidence in using these skills in practice was 65% for the acute and ambulatory nurses and 73% for the public and school nurses. Moreover, participants found the training to be clear and effective and useful for a current or upcoming project. Next slide, please. Responses to open-ended questions about aspects of the training that were most helpful and how they would apply what they learned were favorable. Participants' comments included, "I loved that it was a course that I could do on my own time," and "Any problem, issue, or learning that I need to assess or conduct can be used with evidence-based practice." Other participants stated, "I'll be able to identify areas of need for my patients and quickly be able to find research or research options." And "I learned how to advocate for my patients better. I will educate patients on the evidence behind why they are receiving their care." Another respondent said, "I will thoroughly plan my day using the methods discussed in this module." And another said, "I've always used Google Scholar in the past, but I plan on using PubMed in the future while researching for care." And lastly, a respondent stated, "Knowing more about the how will help me when I'm trying to find the answers to the why questions I encounter." I will hand it back off to Dr. Jones.
Thank you, Dr. Vonderheide. It was our initial intent to launch the newly developed and revised NExT Library Guide website and online courses in the fall of 2020. However, the increased number of COVID cases throughout the state significantly taxed our targeted acute and ambulatory and population health nurses, as well as our school health nurses. These nurses were called upon to serve their communities in numerous ways, from direct frontline care to providing COVID-19 testing to planning mass vaccination clinics throughout the state. Thus, we delayed our launch to January 11th, a time of reduced numbers, increased interest, and engagement among nursing staff at all partnering hospitals and health departments. Following launch of the NExT Library Guide website and online courses, we received questions from participants regarding the CEU certification body, built-in learning activities, and whether all 7 modules needed to be fully completed once started at one sitting. The courses were designed to allow nurses to complete each module at their own pace with multiple logins. We provided a syllabus so that nurses could track their own progress and completion. Once the final module is completed, the CEU is issued. Nurses found it hard to believe that the CEUs were indeed free to them upon module completion. The questions regarding the learning activities pertained as to whether the answers to each activity were tracked and stored within the module for each learner. As Carmen stated, we do not keep track of individual answers, nor are we grading responses. The course uses an adult learner model that relies on course activities to reinforce learning rather than specific answers and grades. To address the CEU accrediting body question, we moved the information from the final page to the website homepage. To assist all learners, we created a frequently asked questions page and it inserted links to the NExT Library Guide on the homepage and the homepage for the online course. There are several implications for nursing. This work continues to provide education on the use of freely available resources, which is particularly significant given the lack of investment by community and acute care agencies in these resources. The modules provide consistent training materials to supplement those offered by participant organizations, while giving participants the opportunity to earn 7 free CEUs. Further, librarians and evidence-based practice leaders seeking this content don't have to create this information. We intend to keep this material freely accessible. We encourage hospital, academic, and clinical librarians to create links to our website and modules and to place these on your agency or institution's website to encourage nurses to utilize these resources. They are there for the sharing. Moreover, participants can select and listen to individual modules within each course, which can serve as a refresher or retraining months later. We have a Facebook and Twitter page. Please follow us. We invite you to join us. So what's next for NExT? We are currently funded for a phase 4 of our collaborative work, building on the success of our initial phases. In the 4th phase of this project, The NExT team has been focused on extending marketing and promotion of evidence-based practice to underserved community hospitals, health departments, and clinical agencies across the state of Illinois, Region 6, and the nation by targeting these institutions and specific national nursing organizations and associations. In addition, we have surveyed previous participants to capture their stories and narrative data from these nurses who live in underserved communities to learn specifically about the challenges and the unfulfilled health information needs or barriers in their communities and how they have applied this information to practice. We just submitted a grant for phase 5 to expand the modules to all public health professionals in collaboration with the University of Wisconsin's New to Public Health Residency Program. In addition, in a subsequent phase 6, we would like to construct evidence-based practice, facilitator and mentor modules, a train the trainers guide, incorporating facilitator skills, including leading a journal club and coaching evidence-based practice teams to create evidence-based practice champions in acute and community-based agencies throughout the state and region. This slide shows our significant reach as we have expanded to 28 states and a majority of Illinois counties. In conclusion, the collaboration of library and nursing faculty has resulted in proven and successful partnerships that have provided instruction in and promoted the use of evidence-based health information to a public school health and acute ambulatory care nursing audience. To date, more than 870 public health and 490 acute and ambulatory care nurses have benefited from our work. Participants in this phase reported overall satisfaction with the online modules, evidence-based practice knowledge attainment, and intent to use these principles in practice. And these next 2 slides provide our references. And then I would just like to end by thanking Region 6 and the National Library of Medicine for the opportunity to speak with all of you today. In the words of Henry Ford, coming together is a beginning, keeping together is progress, and working together is success. So thank you all so much. If you'd like to reach us, I'm available at kjones29@illinois.edu, and we look forward to your questions. Thank you for your time.
Well, thanks, Krista. Thanks to all of our panelists. We do have some questions that have come in. I would like to kick it off with a couple that we've got already queued up. One of the things that's most exciting about this project is that it's a multi-professional collaboration. And as your Henry Ford quote indicated, getting together, launching, and then the key part, sustaining it. I mean, that's really challenging for a lot of collaborative teams like this. What are some of the tips you can share? What kind of advice can you give on other groups that might want to launch something like this?
I'll go ahead and take that question. I would say the main part is our leadership of Dr. Jones. She has done a wonderful job spearheading this the whole time. I think this goes back to 2014. And both librarians and nurses coming together to work has been so instrumental. Dr. Jones has done an awesome job of keeping communication going, keeping us motivated, and just informing us of the next steps. And the librarians have been extremely instrumental. So we started this project, doing face-to-face. We were driving all over Illinois. It was one nurse and one librarian, which was wonderful. We got to see each other's skills. And then we went to phase 2 of NExT 2, and we were able to move that online. And the librarians were so instrumental on disseminating this information. So it's just been a great project of both of our skills, meaning the librarians and the nurses coming together, and then you had Krista's leadership. Krista, what else would you say has been so successful? Because we've been doing this since 2014.
Thanks, Patty, and thank you to everyone. We could not do this without exemplary team members. I mean, we have been truly blessed with some of the best experts in the field as far as librarians, as far as administrative nurses and clinical and agency nurses and hospital librarians, and our partnerships. We've had beautiful partnerships with UI Health and Carle Foundation Hospital and their health system network, and Western Illinois University, and health departments across the state that have just done an exemplary job of getting this information out to their nurses and their staff so that they could partake in this opportunity. So you really have to, I guess it really takes a village is what I'm saying, for everyone, working together, and to have a team of professionals that are committed to the work, but not only committed to it, but, re-energized, about it and passionate about it. And then that just breeds over into everyone else in your unit.
Well, also talking about sustainability, your team's been really successful at securing multi-year funding. What kind of helpful tips, again, would you have for somebody about submitting a request for an award or for grants?
Yeah, so I'll field this question. We actually get asked quite frequently about our success with grant writing. And, really it boils down to some very simple things that sometimes sound a bit silly when you say them out loud. But, simple to understand is not always simple to do. So the number one thing is, when you are doing your proposal, actually answer the questions that you're asked. We like to tell our stories, and sometimes we get wrapped up in our projects because we're very involved in them, and we've been thinking about them for a long time by the time you get to the point of applying for a grant. So it's important to actually answer the questions that you're asked, because the people who are reading the proposals, they don't know your project. So you have to explain to them how it connects. Another important thing is, if you're having trouble answering one of the questions, then maybe you need to think about changing something in your project so that it's easy to answer the question. And again, you are applying for the funding that's there. So you are the one who needs to make adjustments. If you feel that you cannot make the adjustments that need to be made to fit into the grant category, then perhaps you need to find a different funding opportunity. Most of the time, small tweaks in your project can help you. So if they are asking you to explain your evaluation plan, maybe you just need to think about that and create an evaluation plan to include in the project. And then the third thing that I like to remind everyone is that not all questions are questions. So a lot of times there are requirements that are just built into the text of the description of the funding opportunity, and you need to make sure that you find a spot to address each of those requirements in your proposal. So even if they are not specifically asking you how you will do something like be 508 compliant, you need to say in your proposal, we will be, and this is how we will be. And so, again, those all sound really simple. And I'm sure we all know that, but it's sometimes hard to actually do that when it comes down to writing the proposal. And then, like a bonus tip, have someone who knows nothing about the project read the proposal. And if they can't understand what you have written, then you probably need to do a little bit more describing and connecting with your proposal.
Those are great, Carmen. Thank you. You mentioned during the presentation that participants had access to licensed resources such as CINAHL and Cochrane. Did UIC provide online access to unaffiliated users?
So we don't provide access to any unaffiliated users with licensed content. Cochrane does have some content that is available for free that you can do some learning with. And we talked about those. We also do give some skills in our lectures that can be used in resources like CINAHL. And I'm not actually the person who did the resources content. I believe we show some examples from CINAHL. I can't remember for sure, but we do not provide access to those resources. But since CINAHL is so commonly used and some of the larger health systems do have access to it, we do address it because it is a commonly used resource. Does anyone else have something to add to that?
I'll step in, Carmen. This is Frances Drone Silvers. So I'm a librarian at Carle Health, and the only librarian who's not affiliated with the university as part of the group. And so on the LibGuide, we do make comments about where you might go to get access if your organization does not have it. So suggesting people look at community colleges who have nursing programs or other resources and see if they could possibly get access to there.
We did have that one follow-up come in the chat box, and that was asking if you're familiar with any grant writing checklists, best practices, or tips.
I'm not familiar with any of them. If I'm honest, I've been writing grants and proposals for like 20 or 25 years at this point. So I haven't looked for any in a long time. I'm certain they're out there. Does anyone else use any of those?
Yeah, this is Krista, and I do not. I'll ask Dr. Vonderheide, do you use any checklists for your grants? I see her shaking her head, or Dr. Ethanton.
No, the importance, I would say, is consistent with Carmen, and what was drilled in me early on was follow the directions. If you don't understand the directions, contact the person who's listed on the application. Knowing what's been done before, so doing your review, doing your homework, your review of the literature to understand what you're building on and what maybe they did not do well, so that you can contribute to the advancement of the science. Being able to articulate, being able to summarize what's known and what innovative piece you're going to add, I think are really important as well.
Yeah, and I would say look for your mentors. You know, who in your system has written a grant, has been successful in obtaining funding, and go to them. Is there something that they're working on that you could join as your first parlay into grant writing and do a piece of their grant? And then from there, you'll build additional experience as you go on to, you know, being a co-investigator or primary investigator of a future grant.
Yeah, having a team and not being by yourself is crucial to bounce ideas and concepts off of.
Great. The only other question that just came in right now was saying what a wonderful presentation this has been, and that they missed just a little bit of the beginning. I want to let folks know again that this session has been recorded, and we will post it to the NNLM YouTube page in 1 to 2 weeks. Everybody who's registered will receive an email with the link to that recording at that time. And let's see.
I just want to say thank you to Jacqueline for posting all of the links in the chat. That's been amazing throughout the course of the presentation. We really appreciate that. And we agree, Nick. Rebecca's amazing.
And speaking of links, I did put a link into an on-demand class that you can take for free through NNLM. It's a grant and proposal writing on-demand course.
Okay, let's see, Jacqueline, I think that's all of the questions that have come in right now. Is that correct?
The question is, are there any limitations to who can take the course? Can we feel free to share within our states?
Yes, absolutely. Feel free to share. That's what we're designing it for. We're hoping to have a continued national reach, and even internationally, we do have a few countries who've actually had participants take our course. So, and we are looking at, as I stated before, if we are funded for phase 5 with further expansion to other health professions. And
I'll mention Krista just did all of the paperwork and got us approved also for MLA credit. So the functionality is there in the course. If librarians want to get Medical Library Association CE credit, it is there. So it hasn't been broadly announced yet. We don't have all of the stuff on the website yet, but if you take the course, and you can take either one of the paths, whichever you want to, when you get to the end, there is an opportunity, and hopefully very soon we'll have all of that up on the website so that it's more widely known.
Okay. Great. Well, I just want to thank all of our panelists one more time. It was terrific to hear about everything today. And we do have the link here. I think we'll be able to post that in the chat as well. And if you complete that evaluation, you'll receive the link to go in and obtain the MLA CE credit. And I believe that's everything.
Well, thank you again for the opportunity to share.
And thank you so much for the invitation, and thank you to the amazing team. You know, this has just been, there are a total of 12 of us. So just a few of us are here today, but there are a total of 12 nurses and librarians, as you saw from, I think, the second or third slide on this team.
Well, as Patty said, you are our rock, you are our leader, so thank you.
Great. Thank you, everybody, for attending today.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.